So reaching the unreached basically is a dynamic and evolving process which requires the innovation, and it has to be a system-wide approach at the national level, global level, and of course what we are doing. So imagine, there is a lot of mobile users, but still so many people are not still using. So same scenario applies to health. So many patients or the persons, they are unreached with us. These are the various, unreaching in so many arenas are there, but blindness is one of them, and one of the happy patient is this. So three priorities areas, they need strengthening at the primary level. We need to empower our communities and individuals, and we have to address the socio-economic determinants. So these are basically a spoke wheel. One is health system, communities, and political system. So, and again these three systems are integrated within 5 transformative domains. One is political commitment, multi-stakeholders engagement, and of course these are all data-driven decision-making systems. And again we need to have, from taking data, we need to have health service evaluation, and then we have to have some special approaches. For community engagement to contribute to effective change, we need to go into our efforts. We have to have definite goals, we have to have strategies, and then these strategies have to be there in the policymaker and providers, and then we have to go into the community and build our relationship. So blindness is a significant public health problem, not only in India, globally, and we have a disproportionate in everything. So again it is a public health problem, and India is basically the blind capital of the world. So China and India, they account for around 50% of the blindness, and more than 1/4 of the person who are productive age, they are visually impaired. So these are the data about the India, and basically thing is the lack of ophthalmologists, or the manpower needs the redistribution. So India still, keeping all these things in mind, state of Punjab, Haryana, Gujarat, they have, done significant improvement towards elimination of the blindness. And thing over here, whatsoever is the thing, that is the case finding and the treatment initiation course, that is the basic concept into this. And again these things, they have some kind of the adverse factors, especially in India, that there is no need felt by the person, lack of person to accompany, and these are the point which I raised in the recently RAB survey. So screening camps in the vision center, they are the most effective vision strategies for identifying and encouraging individuals to take up the corrective eye surgery. With vision centers, they are the most nodal point. And areas of emphasis, that is, we have to improve our eye banking, our corneal transplant services, and of course the cataract surgical practice, especially the cataract success rate also. And all these things, they need to have basically integrate into the refractive services, which are, the RAB survey is already stressed upon. Refractive surgery, refractive errors, that is at the school level. So role of teleophthalmology, already Dr. Dole and other speakers have already emphasized on this, and that has role in screening, consulting, counseling, prioritizing the patient, optimizing the medications, supervision, follow-ups, education, and everything. So that is how Government of India has already, Dr. Hiteshi said, Ayushman Bhav PM Yojana, that is there, and that is doing a great job. But again, at some states, they need to financial restructuring. So it is contributing to overcome the backlog of India. And more, again in this scheme, the more utilization is still there by the male patient. Female are still lagging behind as per the data in India. So again, this is the PMJ spoken wheel again thing, that PMJ beneficiaries, they take the treatment from the eye care facility also, the district hospital also, private setup also, and even tertiary care also. So they are all covered, and affordable and service subsidized services, they are free or in charity clinics, again that is covered by the PMJ services. So challenges are there. We need to have access to the service. We need to be aware, and we have to accept it also. Financial barriers, that is being overcome by the PMJ Yojana, but still it is unreachable in some of the areas. Cultural barrier, of course, they are still there, and inequitable distributions of the resources. These are the few challenges in reaching the unreached in India, especially the black law of the blindness. So to overcome this, we have to have community outreach programs, especially the Vision Center one, mobile eye care units, Vision Center. Another point which is there, Dr. Kanshuk has already stressed upon, that is school-based vision screening. That is of utmost importance thing. And of course, awareness camps can be held by the panchayat or the local NGOs, and of course, teleophthalmology is again playing a great role. So strengthening the healthcare, we need to have accessibility, inclusivity, and equity, and of course, all these things has to be given a quality, so that our cataract surgical success rate is improved. So we have to empower communities, and of course, individual level also. And community engagement can be done by the health promotion, participation, and social determinants. So we have to address few socio-economic barriers also. That is, we have to have a poverty reduction also. That is a indirect thing. We have to have access to the resources, and of course, the education, the primary thing. So and along with this, we have to provide the social protection also. Again, we have to have digital solutions also, telehealth, innovations in the telehealth, mobile health, and data analytics. Everything depends on improvements and what we learn from our data. So multi-stakeholders, it has to be a collaborative one, it has to be a partnership one, and it has to be a coordinated one. So all these things when fed into the data, that is, we monitor and evaluate, then we do the research on this, and again, based on the research, we do the interventions. So it has to be community outreach, awareness campaigns, and accessible eye care services via. Thank you.